Medical Assistant Exam Review. Question 1. A medical assistant reviews a case where a pulse oximeter is not giving a steady reading on a patient with cold fingers. Which action should the medical assistant try first? Option A. Warm the finger and ensure the sensor is positioned correctly. Option B. Apply the sensor over dark nail polish without adjustment. Option C. Ignore the reading because pulse oximetry is optional. Option D. Place the probe on a moving hand during conversation. The correct answer is option A. Warm the finger and ensure the sensor is positioned correctly. Cold extremities and poor sensor placement can interfere with pulse oximeter detection. Nail polish, movement, and ignoring an unstable reading can all lead to inaccurate oxygen saturation documentation. Question 2. In a medical assistant certification review scenario, an infant arrives for a well-child visit while communicating with the care team. Which measurement is commonly documented in addition to weight and length? Option A. Head circumference. Option B. Snellen distance score. Option C. Peak flow only. Option D. Waist to hip ratio. The correct answer is option A. Head circumference. Head circumference is an important growth measurement for infants and helps monitor development over time. Waist ratios, peak flow values, and Snellen scores are not routine substitutes for infant growth tracking. Question 3. During an annual wellness visit, orthostatic hypotension is suspected after a patient reports dizziness when standing for a patient asking for clarification. Which approach is appropriate? Option A. Take only a single seated blood pressure. Option B. Measure temperature in 3 routes. Option C. Ask the patient to jog briefly before measuring. Option D. Measure blood pressure and pulse after position changes according to protocol. The correct answer is option D. Measure blood pressure and pulse after position changes according to protocol. Orthostatic assessment compares blood pressure and pulse across position changes to evaluate a possible drop with standing. A single seated reading, exertion before measurement, or unrelated temperature checks does not assess the suspected problem. Question 4. After confirming the patient's identity, a temperature of 101.8 degrees Fahrenheit is obtained during intake. How should this finding be handled? Option A. Document the measured value as objective data and report it according to office protocol. Option B. Record that the patient feels feverish without the value. Option C. Wait until the end of the day to mention it. Option D. Change it to normal if the patient denies illness. The correct answer is option A. Document the measured value as objective data and report it according to office protocol. A measured temperature is objective data and should be recorded exactly as obtained. Replacing the value with a vague phrase, delaying a report, or changing the result would make the record inaccurate. Question 5. A provider asks for assistance because a patient requests correction of information in the medical record before the patient leaves the clinic. Which action is appropriate? Option A. Tell the patient records can never be reviewed. Option B. Follow the facility process for an amendment or addendum. Option C. Erase the original entry without documentation. Option D. Change another patient's chart instead. The correct answer is option B. Follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 6. When preparing safe patient care, a patient's height is being measured with a stadiometer for an older adult. Which action supports accuracy? Option A. Round every height to the nearest 6 inches. Option B. Ask the patient to estimate the height from memory. Option C. Measure while the patient is seated in a soft chair. Option D. Have the patient remove shoes and stand straight with heels positioned properly. The correct answer is option D. Have the patient remove shoes and stand straight with heels positioned properly. Removing shoes and using proper posture on the stadiometer improves measurement accuracy. Sitting in a soft chair, excessive rounding, or relying on memory can produce an inaccurate record. Question 7. When preparing safe patient care, a provider asks for an apical radial pulse comparison. Which method is appropriate? Option A. Subtract blood pressure from pulse rate. Option B. Use pulse oximetry only and skip manual counting. Option C. Have 2 staff members count apical and radial pulses at the same time. Option D. Count radial pulse in the morning and apical pulse later. The correct answer is option C. Have 2 staff members count apical and radial pulses at the same time. An apical-radial comparison requires simultaneous counts so a pulse deficit can be identified accurately. Separate timing, unrelated calculations, or relying only on a device does not measure the difference between heartbeats and peripheral pulses. Question 8. When preparing safe patient care, a pulse oximetry reading remains very low after the sensor is repositioned while maintaining privacy. Which action should the medical assistant take? Option A. Report the persistent abnormal reading promptly according to office protocol. Option B. Tell the patient the reading is definitely normal. Option C. Delete the result from the record. Option D. Wait until the next appointment to mention it. The correct answer is option A. Report the persistent abnormal reading promptly according to office protocol. A persistent abnormal oxygen saturation may signal impaired oxygenation and should be escalated promptly. Deleting results, falsely reassuring the patient, or delaying communication can place the patient at risk. Question 9. During a follow-up visit, a returning patient is involved when a patient has no known infection listed in the chart for a returning patient. Which infection control approach still applies? Option A. Use airborne isolation for every routine visit. Option B. Skip hand hygiene when the patient appears healthy. Option C. Wear sterile gloves for all administrative tasks. Option D. Use standard precautions for every patient encounter. The correct answer is option D. Use standard precautions for every patient encounter. Standard precautions assume that blood and body fluids may be infectious and apply to every patient. Appearance alone is not a safety guide, while universal airborne isolation or sterile gloves for non-sterile tasks is unnecessary and inefficient. Question 10. During a skills check, the scenario states that a patient has written instructions about future medical care if unable to speak. Which document is this? Option A. Autoclave indicator. Option B. Advanced directive. Option C. Superbill. Option D. Daily deposit slip. The correct answer is option B. Advanced directive. An advanced directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 11. At the front desk handoff, a new patient is involved when a medical assistant experiences a needle stick while cleaning a room while checking the chart. Which action should be taken first? Option A. Hide the injury if bleeding stops. Option B. Apply lotion and continue rooming patients. Option C. Finish all remaining tasks before reporting. Option D. Wash the area and report the exposure according to policy. The correct answer is option D. Wash the area and report the exposure according to policy. Immediate washing and prompt reporting start the post-exposure process and protect the employee. Hiding the injury, delaying reporting, or simply applying lotion can interfere with timely evaluation and follow-up. Question 12. A provider asks for assistance because a patient is suspected of having active tuberculosis for a patient scheduled for a procedure. Which precaution is most appropriate? Option A. Place the patient in the waiting room until closing. Option B. Use only clean gloves. Option C. Ask the patient to remove any mask to speak clearly. Option D. Use airborne precautions with appropriate respiratory protection. The correct answer is option D. Use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 13. When preparing safe patient care, a reusable surgical instrument must be free of all microorganisms including spores. Which process is required? Option A. Routine dusting. Option B. Sterilization. Option C. Plain water rinsing. Option D. Sanitization only. The correct answer is option B. Sterilization. Sterilization destroys all forms of microbial life including spores when performed correctly. Sanitizing, dusting, or rinsing lowers visible soil or some organisms but does not make an instrument sterile. Question 14. During a skills check, the scenario states that instruments are removed from the autoclave after a cycle while maintaining privacy. Which finding supports that the sterilization process should be reviewed before use? Option A. The chemical indicator has not changed as expected. Option B. The instrument pack is labeled with the date. Option C. The load has a completed log entry. Option D. The package is dry and intact. The correct answer is option A. The chemical indicator has not changed as expected. A failed chemical indicator suggests the sterilization conditions may not have been met and the load should not be used until evaluated. Dry packaging, completed logs, and date labeling are expected quality control elements rather than failure signs. Question 15. During a skills check, the scenario states that a patient has questions about risks before a minor procedure for a patient waiting for the provider. Who should answer clinical risk questions for informed consent? Option A. The receptionist only. Option B. The provider performing or ordering the procedure. Option C. A random patient in the lobby. Option D. The medical assistant by guessing. The correct answer is option B. The provider performing or ordering the procedure. The provider is responsible for explaining risks, benefits, and alternatives so the patient can give informed consent. Reception staff, other patients, or guest explanations do not meet informed consent standards. Question 16. In a medical assistant certification review scenario, a small contained fire is being addressed with a fire extinguisher after alarm procedures. What does the first step in PASS mean? Option A. Prepare billing forms. Option B. Pour water first. Option C. Push the patient. Option D. Pull the pin. The correct answer is option D. Pull the pin. PASS stands for pull, aim, squeeze, and sweep when using an extinguisher. The other choices are unrelated to extinguisher operation and may delay a safe response. Question 17. During a walk-in visit, a patient reports a severe latex allergy before rooming during a high-yield exam review. Which action is appropriate? Option A. Use powdered latex gloves for a better fit. Option B. Ignore the report unless a rash is visible. Option C. Use latex-free supplies and alert the care team. Option D. Document the allergy only after the visit. The correct answer is option C. Use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 18. A provider asks for assistance because a used venipuncture needle is ready for disposal for a patient with limited mobility. Which practice is safest? Option A. Recap with both hands to prevent leakage. Option B. Avoid recapping and dispose of it immediately in a sharps container. Option C. Place it in a coat pocket until the room is cleaned. Option D. Break the needle before disposal. The correct answer is option B. Avoid recapping and dispose of it immediately in a sharps container. Avoiding recapping and placing sharps directly into the proper container reduces needle stick risk. Two-handed recapping, breaking needles, or carrying sharps in pockets are unsafe practices. Question 19. In an outpatient medical office, an exam room is being disinfected between patients. Which workflow is most appropriate? Option A. Disinfect only areas the patient mentions touching. Option B. Clean from less contaminated areas toward more contaminated areas. Option C is start with the trash and then clean the clean supplies. Option D. Use the same wipe until it is visibly dry and dirty. The correct answer is option B. Clean from less contaminated areas toward more contaminated areas. Cleaning from cleaner to dirtier areas helps prevent spreading contamination back onto cleaner surfaces. Starting with trash, overusing wipes, or cleaning only reported contact points leaves avoidable contamination. Question 20. A provider asks for assistance because a pulse oximeter is not giving a steady reading on a patient with cold fingers before documentation is completed. Which action should the medical assistant try first? Option A. Place the probe on a moving hand during conversation. Option B. Warm the finger and ensure the sensor is positioned correctly. Option C. Ignore the reading because pulse oximetry is optional. Option D. Apply the sensor over dark nail polish without adjustment. The correct answer is option B. Warm the finger and ensure the sensor is positioned correctly. Cold extremities and poor sensor placement can interfere with pulse oximeter detection. Nail polish, movement, and ignoring an unstable reading can all lead to inaccurate oxygen saturation documentation. Question 21. After confirming the patient's identity, a fasting glucose specimen is being collected for a patient asking for clarification. Which tube additive is commonly associated with glucose preservation? Option A. No additive in a culture bottle. Option B. Sodium fluoride in a gray top tube. Option C. Sodium citrate in a light blue tube. Option D. EDTA in a lavender tube. The correct answer is option B. Sodium fluoride in a gray top tube. Gray top tubes commonly contain fluoride to help preserve glucose by inhibiting glycolysis. EDTA, citrate, and culture bottles serve different testing purposes and are not the usual glucose-preserving choice. Question 22. A provider asks for assistance because a tourniquet has been applied while locating a vein. Which practice helps prevent hemoconcentration? Option A. Tighten it after blood begins flowing. Option B. Release the tourniquet within about 1 minute when possible. Option C. Apply it over broken skin for grip. Option D. Leave it on until all paperwork is complete. The correct answer is option B. Release the tourniquet within about 1 minute when possible. Prolonged tourniquet application can concentrate blood components and affect results. Leaving it on too long, tightening it unnecessarily, or placing it over broken skin can harm the patient or compromise the specimen. Question 23. For an adult patient in an outpatient setting, a vein tends to roll during palpation while preparing for provider review. Which action can improve venipuncture control? Option A. Anchor the vein by pulling the skin taut below the site. Option B. Ask the patient to pump the fist throughout the draw. Option C. Use the thumb above the puncture site. Option D. Tap the needle against the vein repeatedly. The correct answer is option A. Anchor the vein by pulling the skin taut below the site. Anchoring below the puncture site helps stabilize the vein and improves control. Placing the thumb above the site, repeated tapping with the needle, or ongoing fist pumping can be unsafe or affect specimen quality. Question 24. While reviewing office protocol, an adult patient is involved when an additive tube has just filled during venipuncture for an adult patient. Which action is appropriate? Option A. Invert the tube gently the recommended number of times. Option B. Open the tube and stir it with a swab. Option C. Set it aside without mixing. Option D. Shake it hard until foam appears. The correct answer is option A. Invert the tube gently the recommended number of times. Additive tubes need gentle inversion to mix blood with the additive and prevent clotting or testing errors. Shaking, failing to mix, or opening tubes creates specimen problems and exposure risk. Question 25. During a skills check, the scenario states that a conscious diabetic patient is shaky and has a low glucose reading. Which action is generally appropriate by protocol? Option A. Administer a random antibiotic. Option B. Tell the patient to exercise vigorously. Option C. Give nothing and send the patient to drive home. Option D. Provide a fast-acting carbohydrate if allowed by office policy. The correct answer is option D. Provide a fast-acting carbohydrate if allowed by office policy. A conscious patient with low glucose may need fast-acting carbohydrate according to protocol. Driving, antibiotics, or vigorous exercise can worsen the situation or fail to treat hypoglycemia. Question 26. A provider asks for assistance because a clinic performs a rapid strep test classified as waived while supporting safe patient care. What does waived testing generally mean? Option A. The test never needs quality control. Option B. The result cannot be documented in the chart. Option C. Only a physician may read the result in every setting. Option D. The test is simple and has a low risk of erroneous results when performed correctly. The correct answer is option D. The test is simple and has a low risk of erroneous results when performed correctly. CLIA waived tests are considered simple with low risk when instructions are followed, but quality procedures still matter. Waived status does not remove documentation, training, or quality control responsibilities. Question 27. A medical assistant reviews a case where a patient asks what hemoglobin A1C reflects for a patient in the exam room. Which explanation is most accurate? Option A. Average blood glucose control over roughly the past 2 to 3 months. Option B. Kidney function during the last hour. Option C. White blood cell count after infection. Option D. Blood oxygen level at this exact moment. The correct answer is option A. Average blood glucose control over roughly the past 2 to 3 months. Hemoglobin A1C reflects long-term glucose exposure over the lifespan of red blood cells. It is not a real-time oxygen, kidney, or white blood cell measurement. Question 28. During a skills check, the scenario states that a throat culture is being collected for suspected strep throat. Which technique is appropriate? Option A. Swab the tonsillar area and posterior pharynx while avoiding the tongue and cheeks. Option B. Dip the swab in tap water before collection. Option C. Swab only the outer lips. Option D. Touch the swab to the tongue repeatedly. The correct answer is option A. Swab the tonsillar area and posterior pharynx while avoiding the tongue and cheeks. The tonsillar area and posterior pharynx are the target sites for a throat culture. Swabbing lips, contaminating with tongue contact, or adding tap water can reduce specimen quality. Question 29. When preparing safe patient care, a capillary puncture is needed for an adult patient while working under provider supervision. Which site is generally preferred? Option A. A swollen infected fingertip. Option B. The side of the distal segment of the middle or ring finger. Option C. The center of the thumb pad. Option D. The earlobe for every adult test. The correct answer is option B. The side of the distal segment of the middle or ring finger. The side of the distal middle or ring finger is commonly used because it provides blood flow while reducing injury risk. Thumb punctures, routine earlobe use, and infected sites are not preferred for standard adult finger sticks. Question 30. A medical assistant reviews a case where a pulse rate is documented as tachycardic for an adult patient. Which finding is being described? Option A. Faster than normal heart rate. Option B. Low body temperature. Option C. Slow breathing only. Option D. Inflammation of the stomach. The correct answer is option A. Faster than normal heart rate. Tachycardia describes an abnormally fast heart rate for the patient's situation. Low temperature, slow respirations, and stomach inflammation are different concepts. Question 31. In a medical assistant certification review scenario, a point-of-care glucose test is about to be performed. Which supply check is needed? Option A. Cut the strip in half to save supplies. Option B. Wet the strip before inserting it. Option C. Use any strip from an unlabeled container. Option D. Confirm the test strips are not expired and are stored correctly. The correct answer is option D. Confirm the test strips are not expired and are stored correctly. Expired or improperly stored strips may produce inaccurate glucose results. Unlabeled strips, wetting strips, or altering strip size violates testing procedure and quality standards. Question 32. A provider asks for assistance because a patient is being prepared for a 12-lead EKG during a quality control check. Which action improves electrode contact? Option A. Skip preparation if the patient is in a hurry. Option B. Clean and dry the skin and remove excess hair if needed. Option C. Apply lotion under each electrode. Option D. Place electrodes over heavy clothing. The correct answer is option B. Clean and dry the skin and remove excess hair if needed. Clean, dry skin improves adhesion and electrical signal quality for EKG electrodes. Lotion, clothing, and skipped preparation can increase artifact or lead detachment. Question 33. During an annual wellness visit, a chest lead is being placed during a 12-lead EKG for a patient with diabetes. Where should V2 be positioned? Option A. 4th intercostal space at the right sternal border. Option B. 5th intercostal space at the left midclavicular line. Option C. Right lower abdomen. Option D. A 4th intercostal space at the left sternal border. The correct answer is option D. 4th intercostal space at the left sternal border. V2 belongs at the 4th intercostal space on the left sternal border. Right sternal placement is V1. 5th intercostal midclavicular placement is V4, and the right lower abdomen is a limb lead area. Question 34. During a routine office visit, a patient scheduled for a procedure is involved when an EKG tracing shows irregular spikes while the patient talks and moves. Which action should the medical assistant take? Option A. Ask the patient to relax, remain still, and avoid talking during the recording. Option B. Move electrodes randomly until spikes disappear. Option C. Ignore the artifact and file the tracing. Option D. Increase room noise so the patient relaxes. The correct answer is option A. Ask the patient to relax, remain still, and avoid talking during the recording. movement and muscle activity can create artifact that interferes with interpretation. Noise, random lead movement, or ignoring the artifact does not correct the signal problem. Question 35. When preparing safe patient care, a patient becomes angry about a long wait after noticing a potential safety concern. Which response is best? Option A, threaten to cancel care immediately without policy. Option B, argue loudly in front of other patients. Option C, mock the patient's concern. Option D, use a calm voice, acknowledge the frustration, and offer to check the status. The correct answer is option D. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 36. While following clinic policy, the medical assistant notes that a patient reports new chest pain while an EKG is being recorded for a pediatric patient. Which action should the medical assistant take? Option A, notify the provider immediately according to emergency protocol. Option B, finish filing old charts before reporting. Option C, erase the tracing because pain changes results. Option D, tell the patient to drive home and rest. The correct answer is option A. Notify the provider immediately according to emergency protocol. New chest pain can represent an urgent cardiac concern and should be escalated immediately. Delaying, advising the patient to drive, or deleting clinical information can endanger the patient. Question 37. A provider asks for assistance because a provider asks whether a tracing has a basic sinus pattern. Which feature supports that pattern? Option A. No relationship between atrial and ventricular activity. Option B. Random spikes caused by loose leads. Option C. A missing QRS after every beat. Option D. AP wave before each QRS complex with a consistent rhythm. The correct answer is option D. AP wave before each QRS complex with a consistent rhythm. Sinus rhythm generally includes AP wave before each QRS complex with consistent conduction. Missing QRS complexes, artifact spikes, or unrelated atrial and ventricular activity do not support a simple sinus pattern. Question 38. At a new patient intake, a patient who appears anxious is involved when a patient is cold and shivering during an EKG after confirming office policy. Which artifact is most likely? Option A. A guaranteed myocardial infarction. Option B. A blood pressure cuff leak. Option C. Muscle artifact that makes the tracing appear noisy. Option D. A normal calibration mark only. The correct answer is option C. Muscle artifact that makes the tracing appear noisy. Shivering creates muscle activity that can make the tracing noisy and difficult to interpret. It should not be assumed to be a heart attack, a cuff problem, or only a calibration mark. Question 39. A provider asks for assistance because a patient needs the chest exposed for electrode placement for a patient with diabetes. Which action protects dignity? Option A. Leave the door open for airflow. Option B. Ask unrelated staff to watch the setup. Option C. Use draping and expose only the areas needed for electrode placement. Option D. Discuss the patient's body in the hallway. The correct answer is option C. Use draping and expose only the areas needed for electrode placement. Draping and limited exposure protect privacy while allowing accurate electrode placement. Open doors, unnecessary observers, and hallway comments violate dignity and confidentiality. Question 40. While assisting with patient care, a patient takes several products for cold symptoms and pain. Which concern should be reviewed with acetaminophen? Option A. It should be taken only by injection. Option B. It replaces all vaccines. Option C. It always causes bacterial resistance. Option D. Accidental duplicate dosing can increase liver injury risk. The correct answer is option D. Accidental duplicate dosing can increase liver injury risk. Many over-the-counter products contain acetaminophen, so duplicate dosing can exceed safe daily limits and harm the liver. It does not cause antibiotic resistance, replace vaccines, or require injection use. Question 41. A medical assistant reviews a case where an intramuscular injection is ordered in the deltoid site while preventing documentation errors. Which action supports safety? Option A. Use the same site repeatedly without assessment. Option B. Inject directly into the elbow crease. Option C, identify the correct landmark and avoid injecting too low on the arm. Option D, choose the site through clothing. The correct answer is option C. Identify the correct landmark and avoid injecting too low on the arm. Correct landmarking helps place the medication in muscle and reduces risk of nerve or tissue injury. The elbow crease, injection through clothing, or repeated use without assessment are unsafe techniques. Question 42. During an annual wellness visit, a patient asking for clarification is involved when a tuberculin skin test is being administered for a patient asking for clarification. Which technique is appropriate? Option A, insert the needle shallowly with the bevel up to create a small wheal. Option B, massage the site hard after injection. Option C, inject deeply into the gluteal muscle. Option D, apply heat to spread the medication. The correct answer is option A. Insert the needle shallowly with the bevel up to create a small wheal. An intradermal test is placed just under the epidermis and should create a small wheal. Deep injection, massage, or heat can alter the test placement and interfere with reading. Question 43. While following clinic policy, the medical assistant notes that insulin is prescribed in units. Which equipment is appropriate for measuring it? Option A, an insulin syringe calibrated in units. Option B, a medicine cup for tablets. Option C, a tuberculin syringe marked only in milliliters without conversion. Option D, a household teaspoon. The correct answer is option A, an insulin syringe calibrated in units. Insulin syringes are specifically calibrated in units to match insulin dosing. Household spoons, unconverted milliliter markings, and tablet cups do not provide safe insulin measurement. Question 44. When preparing safe patient care, a patient asks why pulse may be checked before taking a beta blocker while preventing documentation errors. Which explanation is accurate? Option A, they are used only as antibiotics. Option B, beta blockers can lower heart rate and blood pressure. Option C, they make pulse checks unnecessary. Option D, they always raise blood glucose immediately. The correct answer is option B. Beta blockers can lower heart rate and blood pressure. Beta blockers commonly reduce heart rate and blood pressure, making pulse assessment clinically relevant. They are not antibiotics, do not always raise glucose immediately, and do not eliminate the need for monitoring. Question 45. A medical assistant reviews a case where a tympanic temperature is ordered for an adult patient for a patient waiting for the provider. Which technique is appropriate? Option A, position the ear canal according to device instructions before inserting the covered probe. Option B, use the probe without a cover to improve contact. Option C, force the probe deeply into the ear canal. Option D, use the same technique for every age without adjustment. The correct answer is option A. Position the ear canal according to device instructions before inserting the covered probe. Tympanic accuracy depends on proper ear canal positioning and a clean probe cover. Uncovered probes, forceful insertion, and ignoring age-specific technique can cause infection risk, discomfort, or inaccurate readings. Question 46. A medical assistant reviews a case where a patient develops hives, wheezing, and throat tightness after an injection. Which emergency medication may be indicated by protocol? Option A, epinephrine. Option B, oral iron only. Option C, routine multivitamin. Option D, topical sunscreen. The correct answer is option A, epinephrine. Epinephrine is the first-line emergency medication commonly used for anaphylaxis because it supports airway and circulation. Iron, sunscreen, and multivitamins do not treat acute allergic airway compromise. Question 47. During a skills check, the scenario states that a handwritten order uses the abbreviation U for units while prioritizing patient safety. Which action is safest? Option A, change it to milligrams without asking. Option B, ignore the abbreviation and give any dose. Option C, clarify the order because you can be misread. Option D, assume you means unlimited refills. The correct answer is option C, clarify the order because you can be misread. The abbreviation U can be mistaken for a zero or other marking, so clarification prevents dosing errors. Guessing, changing units, or giving an arbitrary dose is unsafe. Question 48. A medical assistant reviews a case where a patient asks whether to stop an antibiotic once symptoms improve for a patient in the exam room. Which instruction is generally appropriate? Option A, double the next dose to finish faster. Option B, save the rest for a family member. Option C, stop immediately when feeling better every time. Option D, follow the prescribed course and contact the provider before stopping early. The correct answer is option D. Follow the prescribed course and contact the provider before stopping early. Antibiotics should be taken as prescribed unless the provider changes the plan, which helps treatment success and stewardship. Stopping early, sharing medication, or doubling doses can be unsafe and ineffective. Question 49. During a skills check, the scenario states that an order is for 500 mg and the available tablets are 250 mg each. How many tablets are needed? Option A, 2 tablets. Option B, 0.5 tablet. Option C, 4 tablets. Option D, 10 tablets. The correct answer is option A, 2 tablets. Dividing the ordered dose of 500 mg by 250 mg per tablet gives 2 tablets. The other amounts would provide too little or too much medication. Question 50. During a geriatric visit, a small blood spill occurs on an exam room floor while supporting safe patient care. Which action should be included? Option A, clean it with a dry tissue only. Option B, cover it with paper and leave it for housekeeping tomorrow. Option C, ask a visitor to wipe it up. Option D, wear appropriate PPE and disinfect according to bloodborne pathogen policy. The correct answer is option D. Wear appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 51. A provider asks for assistance because a provider describes a patient's heart rate as bradycardic for a new patient. What does this mean? Option A, absent breathing. Option B, slower than normal heart rate. Option C, faster than normal heart rate. Option D, high blood sugar. The correct answer is option B, slower than normal heart rate. Bradycardia means a slower than normal heart rate based on clinical context. Tachycardia, apnea, and hyperglycemia describe different findings. Question 52. While preparing the exam room, a patient's blood glucose is described as hyperglycemic. What does the prefix hyper indicate? Option A, below normal. Option B, high or excessive. Option C, without pain. Option D, around the heart. The correct answer is option B, high or excessive. Hyper means high or excessive, so hyperglycemia refers to elevated blood glucose. Below normal, around the heart, and without pain are represented by different word parts. Question 53. While following clinic policy, the medical assistant notes that a chart lists hypertension as a chronic condition while supporting safe patient care. Which finding is associated with this diagnosis? Option A, inflamed tonsils. Option B, persistently elevated blood pressure. Option C, low body temperature. Option D, low blood oxygen only. The correct answer is option B, persistently elevated blood pressure. Hypertension refers to blood pressure that remains elevated over time. Oxygen saturation, tonsil inflammation, and temperature changes describe different clinical problems. Question 54. In a medical assistant certification review scenario, a patient uses a rescue inhaler during episodes of wheezing for a patient with hypertension. Which process is commonly involved in asthma? Option A, failure of the eardrum to vibrate. Option B, loss of tooth enamel only. Option C, bronchoconstriction and airway inflammation. Option D, excess bone growth in the femur. The correct answer is option C, bronchoconstriction and airway inflammation. Asthma commonly involves narrowed inflamed airways that can cause wheezing and shortness of breath. Bone growth, eardrum movement, and tooth enamel loss do not explain asthma symptoms. Question 55. While assisting with patient care, a diabetic patient is shaky, sweating, and confused before lunch. Which condition should be considered? Option A, hypoglycemia. Option B, dermatitis only. Option C, hyperopia. Option D, otitis media. The correct answer is option A, hypoglycemia. Shaking, sweating, and confusion can occur with low blood glucose, especially when meals are delayed. Vision farsightedness, middle ear infection, and skin inflammation do not best match this symptom pattern. Question 56. While following clinic policy, the medical assistant notes that a medical term ends in itis before the patient leaves the clinic. What does the suffix usually mean? Option A, inflammation. Option B, blood condition. Option C, surgical removal. Option D, visual examination. The correct answer is option A, inflammation. Itis means inflammation, as in dermatitis or tonsillitis. Surgical removal, visual examination, and blood condition are usually represented by ectomy, scopy, and EMEA. Question 57. For an older adult in an outpatient setting, a procedure name ends in ectomy for an older adult. What does the suffix mean? Option A, inflammation. Option B, paralysis. Option C, surgical removal. Option D, enlargement. The correct answer is option C, surgical removal. Ectomy means surgical removal, such as appendectomy. Inflammation, paralysis, and enlargement use different suffixes. Question 58. While following clinic policy, the medical assistant notes that the word gastroscopy contains gastr/o. What body part is referenced? Option A, nerve. Option B, bladder. Option C, stomach. Option D, the lung. The correct answer is option C, stomach. Gastr/o refers to the stomach and appears in terms involving gastric structures or procedures. Lung, nerve, and bladder use different combining forms. Question 59. A provider asks for assistance because a rash is described as proximal to the wrist while following standard precautions. What does proximal mean? Option A, farther from the trunk. Option B, closer to the trunk or point of attachment. Option C, toward the skin surface. Option D, on the back side only. The correct answer is option B, closer to the trunk or point of attachment. Proximal means closer to the trunk or the point where a limb attaches. Distal, posterior, and superficial refer to different anatomical directions. Question 60. A medical assistant reviews a case where a medical assistant needs more detail about a patient's abdominal discomfort for a patient scheduled for a procedure. Which question uses an open-ended interviewing technique? Option A. Is the pain exactly a 5? Option B. Can you describe what the discomfort feels like? Option C. Does it hurt, yes or no? Option D. You do not have nausea, correct? The correct answer is option B. Can you describe what the discomfort feels like? Open-ended questions invite the patient to describe symptoms in their own words and often reveal more complete information. Yes or no prompts, forced ratings, and leading questions limit the response and may miss important details. Question 61. For a patient with hypertension in an outpatient setting, a patient reports burning during urination and urinary frequency. Which condition may be suspected? Option A, urinary tract infection. Option B, otitis externa. Option C, myopia. Option D, sprained ankle only. The correct answer is option A, urinary tract infection. Burning with urination and frequency are common symptoms associated with urinary tract infection. Ear canal infection, nearsightedness, and ankle injury do not best explain urinary symptoms. Question 62. After confirming the patient's identity, a patient has low hemoglobin and complains of fatigue after noticing a potential safety concern. Which condition is being described? Option A, dermatophyte infection. Option B, appendicitis. Option C, anemia. Option D, hypertension. The correct answer is option C, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 63. After confirming the patient's identity, a staff member asks for a patient's full chart to answer a simple billing question for a new patient. Which HIPAA principle applies? Option A, share the entire chart because staff are curious. Option B, send the chart to a friend for advice. Option C, use only the minimum necessary information to complete the task. Option D, post the details in the waiting room. The correct answer is option C, use only the minimum necessary information to complete the task. The minimum necessary standard limits access and disclosure to what is needed for the job task. Curiosity, public posting, or sharing outside the care team violates privacy expectations. Question 64. For a patient with a routine complaint in an outpatient setting, an insurance plan must approve a medication before it is dispensed. What process is being requested? Option A, waive scheduling. Option B, coinsurance posting. Option C, alphabetic indexing. Option D, prior authorization. The correct answer is option D, prior authorization. Prior authorization is payer approval required before certain medications or services are covered. Coinsurance, scheduling style, and filing order are separate administrative concepts. Question 65. After confirming the patient's identity, a patient has symptoms consistent with influenza during clinical workflow. Which PPE is commonly used for close contact? Option A, no mask because influenza is not contagious. Option B, a surgical mask with standard precautions. Option C, a lead apron. Option D, only sterile shoe covers. The correct answer is option B, a surgical mask with standard precautions. Droplet precautions help reduce exposure to respiratory droplets during close contact. Lead aprons, no mask, and sterile shoe covers do not address the main transmission route for influenza-like illness. Question 66. During a skills check, the scenario states that an insurance plan states the patient must pay a set amount before coverage begins for a new patient. Which term applies? Option A, contraindication. Option B, deductible. Option C, consent form. Option D, copayment. The correct answer is option B, deductible. A deductible is the amount the patient pays before the plan begins paying for covered services. A copayment, consent form, and contraindication are different healthcare terms. Question 67. A provider asks for assistance because a claim needs a code for the patient's diagnosis. Which code set is used? Option A, HCPCS Level 2 only. Option B, NDC only. Option C, CPT only. Option D, ICD-10-CM. The correct answer is option D, ICD-10-CM. ICD-10-CM codes describe diagnoses and reasons for encounters. CPT, HCPCS Level 2, and NDC identify procedures, supplies, or drug products rather than diagnoses. Question 68. For a new patient in an outpatient setting, a claim includes durable medical equipment supplied to a patient during clinical workflow. Which code set may be used? Option A, HCPCS Level 2. Option B, a pain rating scale. Option C, the provider's lunch schedule. Option D, only the patient's zip code. The correct answer is option A, HCPCS Level 2. HCPCS Level 2 codes are commonly used for supplies, equipment, and some services not fully described by CPT. Zip codes, schedules, and pain scales are not coding systems for durable medical equipment. Question 69. A provider asks for assistance because a provider marks diagnoses and services after the visit for billing for a new patient. Which document is often used? Option A, autoclave pouch. Option B, electrode tab. Option C, superbill or encounter form. Option D, suture package. The correct answer is option C, superbill or encounter form. A superbill or encounter form captures visit services and diagnoses for billing workflow. Sterilization pouches, suture packages, and electrode tabs are clinical supplies rather than billing documents. Question 70. While following clinic policy, the medical assistant notes that adult CPR is started according to current basic life support guidance. Which compression rate is commonly taught? Option A, 100 to 120 compressions per minute. Option B, 1 compression every 5 minutes. Option C, 10 to 20 compressions per minute. Option D, 250 to 300 compressions per minute. The correct answer is option A, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 71. During a skills check, the scenario states that paper charts are filed alphabetically after reviewing the order. Which name is usually used first? Option A, favorite color. Option B, patient's last name. Option C, appointment room number. Option D, street number only. The correct answer is option B, patient's last name. Alphabetic filing generally starts with the patient's last name to maintain consistent record organization. Color preferences, street numbers, and room numbers do not provide reliable alphabetic indexing. Question 72. While rooming a patient, several patients are scheduled at the beginning of the hour and seen in order of arrival or need for a patient with a routine complaint. Which system is this? Option A, sterilization cycle. Option B, double entry bookkeeping. Option C, wave scheduling. Option D, pulse deficit scheduling. The correct answer is option C, wave scheduling. Wave scheduling brings multiple patients in during a time block to manage provider flow. Bookkeeping, sterilization, and pulse comparison are unrelated concepts. Question 73. A medical assistant reviews a case where a patient misses a scheduled appointment without canceling. Which action is appropriate? Option A, delete the appointment from the record. Option B, bill any random amount without policy. Option C, discuss the patient publicly in the waiting room. Option D, document the no-show and follow office policy for follow-up. The correct answer is option D, document the no-show and follow office policy for follow-up. No-shows should be documented and handled consistently according to office policy. Deleting records, arbitrary billing, or public discussion creates administrative and privacy problems. Question 74. A provider asks for assistance because a patient requests correction of information in the medical record while communicating with the care team. Which action is appropriate? Option A, erase the original entry without documentation. Option B, tell the patient records can never be reviewed. Option C, follow the facility process for an amendment or addendum. Option D, change another patient's chart instead. The correct answer is option C, follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 75. A medical assistant reviews a case where a procedure is performed after the patient clearly refuses touching for a patient with hypertension. Which legal concern may apply? Option A, capitation. Option B, abandonment only. Option C, defamation only. Option D, battery. The correct answer is option D, battery. Battery involves unauthorized physical contact and can occur when touching continues after refusal. Defamation, abandonment, and capitation refer to different legal or payment concepts. Question 76. For a patient with diabetes in an outpatient setting, a patient has questions about risks before a minor procedure. Who should answer clinical risk questions for informed consent? Option A, the receptionist only. Option B, the provider performing or ordering the procedure. Option C, a random patient in the lobby. Option D, the medical assistant by guessing. The correct answer is option B, the provider performing or ordering the procedure. The provider is responsible for explaining risks, benefits, and alternatives so the patient can give informed consent. Reception staff, other patients, or guest explanations do not meet informed consent standards. Question 77. While following clinic policy, the medical assistant notes that a procedure is performed after the patient clearly refuses touching while checking the chart. Which legal concern may apply? Option A, abandonment only. Option B, capitation. Option C, defamation only. Option D, battery. The correct answer is option D, battery. Battery involves unauthorized physical contact and can occur when touching continues after refusal. Defamation, abandonment, and capitation refer to different legal or payment concepts. Question 78. In a medical assistant certification review scenario, a clinic may be liable for an employee's actions within job duties for a patient with limited mobility. Which doctrine is described? Option A, informed refusal. Option B, deductible carryover. Option C, homeostasis. Option D, respondeat superior. The correct answer is option D, respondeat superior. Respondeat superior means an employer may be responsible for certain employee actions performed within the scope of employment. The other terms describe consent, insurance, or physiology rather than employer liability. Question 79. A medical assistant reviews a case where a patient has written instructions about future medical care if unable to speak. Which document is this? Option A, advance directive. Option B, daily deposit slip. Option C, autoclave indicator. Option D, super bill. The correct answer is option A, advance directive. An advance directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 80. Before the provider enters the room, a patient who appears anxious is involved when a cold pack is applied for a minor injury as ordered while communicating with the care team. Which safety instruction is important? Option A, apply ice directly until the skin turns white. Option B, place a barrier between the cold pack and skin and monitor the area. Option C, use heat at the same time on the same site. Option D, leave it on for several hours unattended. The correct answer is option B. Place a barrier between the cold pack and skin and monitor the area. A barrier and monitoring reduce the risk of tissue injury from cold exposure. Direct prolonged ice, unattended use, or combining heat and cold inappropriately can harm the skin. Question 81. In a medical assistant certification review scenario, a patient is anxious about a procedure for a patient in the exam room. Which behavior shows active listening? Option A, look away and type unrelated notes. Option B, maintain appropriate eye contact and summarize the patient's concern. Option C, tell the patient anxiety is silly. Option D, interrupt to finish the patient's sentences. The correct answer is option B. Maintain appropriate eye contact and summarize the patient's concern. Active listening uses attention, reflection, and clarification to show the patient was heard. Interrupting, disengaging, or minimizing feelings can increase anxiety and reduce trust. Question 82. When preparing safe patient care, a patient says they are scared about a biopsy result. Which response is therapeutic? Option A, everyone gets scared, so stop worrying. Option B, that sounds frightening. I can let the provider know you have concerns. Option C, I know for sure nothing is wrong. Option D, you should not ask questions. The correct answer is option B. That sounds frightening. I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 83. After confirming the patient's identity, a medical assistant reports a patient concern to the provider using SPAR during a high-yield exam review. What does the S represent? Option A, supine. Option B, super bill. Option C, sterilization. Option D, situation. The correct answer is option D, situation. In SPAR, situation introduces the immediate issue being communicated. Sterilization, super bill, and supine are unrelated to the SPAR communication framework. Question 84. While following clinic policy, the medical assistant notes that a child has injuries that raise reasonable suspicion of abuse for a patient with limited mobility. Which action is appropriate? Option A, follow mandatory reporting and office policy immediately. Option B, ask the suspected abuser for permission to report. Option C, post pictures online to get opinions. Option D, ignore it because reporting is uncomfortable. The correct answer is option A, follow mandatory reporting and office policy immediately. Healthcare workers may have mandatory reporting duties when abuse is suspected, depending on law and policy. Ignoring signs, seeking permission from a suspected abuser, or posting information online is unsafe and inappropriate. Question 85. During a skills check, the scenario states that a 12-lead EKG requires limb electrodes. Which label belongs on the right arm area? Option A, RA. Option B, LA. Option C, LL. Option D, V4. The correct answer is option A, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 86. A medical assistant reviews a case where a clinic applies appointment policies fairly to all patients while preparing for provider review. Which ethical principle is reflected? Option A, justice. Option B, hemolysis. Option C, tachycardia. Option D, polyuria. The correct answer is option A, justice. Justice involves fairness and equitable treatment. Tachycardia, hemolysis, and polyuria are clinical terms rather than ethical principles. Question 87. During a certification-style scenario, a patient with a routine complaint is involved when a patient becomes angry about a long wait for a patient with a routine complaint. Which response is best? Option A. Use a calm voice, acknowledge the frustration, and offer to check the status. Option B. Argue loudly in front of other patients. Option C. Threaten to cancel care immediately without policy. Option D. Mock the patient's concern. The correct answer is option A. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 88. During a skills check, the scenario states that a patient feels faint after a blood draw. Which action is appropriate? Option A. Help the patient lie down safely and notify the provider as needed. Option B. Tell the patient to run outside for air. Option C. Give insulin without checking blood glucose. Option D. Leave the patient alone in the chair. The correct answer is option A. Help the patient lie down safely and notify the provider as needed. A faint patient should be protected from falling and assessed according to protocol. Running, leaving the patient alone, or giving unrelated medication can create harm. Question 89. While following clinic policy, the medical assistant notes that a conscious diabetic patient is shaky and has a low glucose reading while preparing for provider review. Which action is generally appropriate by protocol? Option A. Provide a fast-acting carbohydrate if allowed by office policy. Option B. Give nothing and send the patient to drive home. Option C. Administer a random antibiotic. Option D. Tell the patient to exercise vigorously. The correct answer is option A. Provide a fast-acting carbohydrate if allowed by office policy. A conscious patient with low glucose may need fast-acting carbohydrate according to protocol. Driving, antibiotics, or vigorous exercise can worsen the situation or fail to treat hypoglycemia. Question 90. During a certification-style scenario, an office policy emphasizes avoiding preventable patient harm for a returning patient. Which ethical principle is involved? Option A. Capitation. Option B. Respondeat copying. Option C. Non-maleficence. Option D. Downcoding. The correct answer is option C. Non-maleficence. Non-maleficence means avoiding harm and is central to safe healthcare practice. Capitation and downcoding are payment or coding terms, while the third option is not a valid ethical principle. Question 91. For a new patient in an outpatient setting, a patient twists an ankle in the parking lot. Which first aid concept may be used initially? Option A. Rest, ice, compression, and elevation as appropriate. Option B. Sterilize the ankle in an autoclave. Option C. Heat, running, and deep massage immediately. Option D. Ignore swelling until next year. The correct answer is option A. Rest, ice, compression, and elevation as appropriate. Initial sprain care often uses rest, ice, compression, and elevation to reduce swelling and protect the area. Heat, running, ignoring symptoms, or autoclaving are inappropriate. Question 92. A medical assistant reviews a case where a patient is pale, cool, clammy, and confused after an injury during clinical workflow. Which condition is a concern? Option A. Shock. Option B. Myopia. Option C. Acne. Option D. Otitis externa. The correct answer is option A. Shock. Pale cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 93. For a patient asking for clarification in an outpatient setting, an AED is available for an unresponsive patient with no normal breathing for a patient asking for clarification. Which action is appropriate? Option A. Ignore the AED because it gives instructions. Option B. Turn on the AED and follow its prompts while continuing emergency response. Option C. Use the AED only after the clinic closes. Option D. Place the pads over thick clothing. The correct answer is option B. Turn on the AED and follow its prompts while continuing emergency response. AEDs are designed to guide rescuers through pad placement and rhythm analysis during cardiac arrest response. Pads over clothing, unnecessary delays, or ignoring available prompts can reduce effectiveness. Question 94. For a patient with limited mobility in an outpatient setting, a disinfectant splashes into a staff member's eye. Which first response is appropriate? Option A, rub the eye hard to remove chemical. Option B, use hand sanitizer in the eye. Option C, flush the eye with water or eye wash for the recommended time and report the exposure. Option D, cover it and wait until tomorrow. The correct answer is option C. Flush the eye with water or eye wash for the recommended time and report the exposure. Chemical eye exposure requires immediate flushing and reporting according to the safety data sheet and facility policy. Rubbing, delaying, or adding sanitizer can worsen injury. Question 95. For a patient who appears anxious in an outpatient setting, a medical assistant reports a patient concern to the provider using SPAR before the patient leaves the clinic. What does the S represent? Option A, situation. Option B, sterilization. Option C, superbill. Option D, supine. The correct answer is option A, situation. In SPAR, situation introduces the immediate issue being communicated. Sterilization, superbill, and supine are unrelated to the SPAR communication framework. Question 96. While following clinic policy, the medical assistant notes that a dressing change is being performed on a draining wound for a patient asking for clarification. Which action is appropriate? Option A, place soiled dressings on the clean supply tray. Option B, document the wound before assessing it. Option C, reuse old tape to save supplies. Option D, use clean or sterile technique as ordered and dispose of soiled dressings properly. The correct answer is option D. Use clean or sterile technique as ordered and dispose of soiled dressings properly. Dressing changes require technique appropriate to the order and safe disposal of contaminated materials. Placing soiled items with clean supplies, reusing tape, or documenting before assessment can create infection and accuracy problems. Question 97. After confirming the patient's identity, a Snellen chart is used during screening. Which function is being assessed? Option A, blood glucose average. Option B, blood clotting time. Option C, distance visual acuity. Option D, hearing threshold. The correct answer is option C, distance visual acuity. A Snellen chart screens how clearly a patient sees at a distance. Hearing, coagulation, and glucose control require different tests. Question 98. While following clinic policy, the medical assistant notes that a patient performs a pulmonary function test while following standard precautions. Which instruction helps obtain a useful result? Option A, stop as soon as mild effort begins. Option B, seal lips around the mouthpiece and follow coaching for a full effort. Option C, breathe around the mouthpiece. Option D, chew gum during the test. The correct answer is option B. Seal lips around the mouthpiece and follow coaching for a full effort. Spirometry requires a tight seal and strong coached effort for reliable measurements. Leaking air, early stopping, or chewing interferes with test accuracy. Question 99. A medical assistant reviews a case where ear irrigation is ordered for cerumen removal for a patient with limited mobility. Which precaution is important? Option A, use very hot water to dissolve wax quickly. Option B, aim forcefully at the eardrum. Option C, proceed even if the patient reports severe ear pain. Option D, verify the order and screen for contraindications such as ear pain or perforation history. The correct answer is option D. Verify the order and screen for contraindications such as ear pain or perforation history. Ear irrigation requires appropriate order, temperature, and screening because perforation or infection can make irrigation unsafe. Hot water, forceful aiming, or ignoring pain can injure the patient. Question 100. During a clinical skills check, a patient with a routine complaint is involved when a patient is cold and shivering during an EKG. Which artifact is most likely? Option A, a normal calibration mark only. Option B, a blood pressure cuff leak. Option C, muscle artifact that makes the tracing appear noisy. Option D, a guaranteed myocardial infarction. The correct answer is option C, muscle artifact that makes the tracing appear noisy. Shivering creates muscle activity that can make the tracing noisy and difficult to interpret. It should not be assumed to be a heart attack, a cuff problem, or only a calibration mark.